Hi, and welcome to Talkspace for Business. Our guest is from Expedia Group, and today we're going to talk about the evolution of mental health care. I'm Pablo McCabe, your host. I'm an LCSW, and I'm the VP of Healthcare and Account Strategy at Talkspace. And our guest today is Laura DeCook, Wellbeing Specialist from Expedia, and we're really excited to talk to her. So if we can go to the next slide. So today we'll discuss the ways in which mental health care needs and priorities have changed, how Talkspace has grown to address mental health care and the evolution, Expedia's mental health strategy, the future of care at Talkspace. Next slide. So cultural changes in healthcare. So let's talk about that for a second and understand what's happening and what we're trying to do. And really the goal is reducing stigma through advocacy and expanded language and openness to sharing. So when we talk about that, we really mean, how do we shift mental health care from the taboo topic that it is, where only serious conditions and trauma services needed for somebody, to really anybody who is, might be considered doing well and or struggling with some kind of clinical conditions. So really opening it up to everybody. And in that way, that's how we increase the access and decrease the stigma. And by increasing the access as well, what Talkspace has done is opened up therapy and psychiatry to someone's home, digital, and a number of options so that you can have access 24/7. And then really, how do we make sure that cost isn't a barrier? And so we've worked on that with lower cost and benefit plans and coverage. And that's really important. What we see is that the research seeks to validate and improve virtual practice. And we're a part of 20 or more major research labs and organization partners. So Talkspace has really taken the time to understand what the data is going to tell us. So not only do we do a good job today, but how do we continue to improve? And then finally, just making sure that we continue to also look at in the future how we expand both the teletherapy through technology. So Talkspace is evolving to the changes in the demand for care and what a year or so it's been to evolve. Developing resources and content and stories, psychotherapy, therapy content. So really now trying to look at how do we expand therapy with new tools, including psychiatry, and also tackling family, in particular, relationships through our new service, Lasting. Then there's also addressing provider strain and availability. Never has there been such a need. Never have therapists sought after and are busy and full. So how did we make sure not only to be contracted in all 50 states, but what did we do when we saw our model? And how did we grow? We added a W-2 full-time therapist to the Talkspace network, thereby enriching and growing the experience for both the user member as well as the provider. The providers have talked about having a sense of community that they didn't have in their own private practice. Then there's focusing on the equity of a diverse population, so important these days. And so the care of all individuals, 13 plus on a global scale. So I think that's one important thing, again, to highlight, is Talkspace works with 13 and plus. So when we looked at that and all of the population throughout the country, all our folks that belong to companies, we really had to take a hard look and grow. And so we've grown our network diversity, our cultural competency, as well as understanding and having international partnerships to serve those abroad. So let me talk about some new features and some care options. Relationships, never easy, especially in this time of the pandemic, to navigate. And but we also wanted to make sure that it wasn't just a therapist that might be able to help a couple, but really give a couple self-guided relationship tools and counseling mechanisms to improve their relationship. So in many ways, what really told us that lasting, this couples option, was helpful was that over 10,000 practicing therapists use lasting with their own clients. So that was really validating to us. And for many things, clients can easily sign up and complete tasks individually on the lasting app. And then guided sessions are used to each client to compare and connect with their partner. So it's really helping each partner get better educated and then figure out how to communicate with their partner in ways that are helpful, different communication styles, tools, and then also live webinars. And what we see in the reporting and data is 94% of users report stronger relationships with lasting. It's an incredible feature, and I encourage everybody to take the quiz. Psychiatry. Nothing is harder than getting an appointment with a psychiatrist, and I think we all know that. It can be not only weeks, but sometimes months. So again, what was important to us as we saw both the huge need during last year as well as it continues was expanding our services to not only therapy in a diverse population, but psychiatry, and finding psychiatric prescribers in all 50 states, and making sure that within 1 week, somebody can see a psychiatrist on a live video session. So what is that service? Well, for many people, they're really looking for an evaluation, and then prescription, and then medication management to help them along their journey. And in that way too, we have a collaborative platform that allows the therapist and the psychiatrist to work together seamlessly. In the past, coordination of care between a therapist and a psychiatrist was almost impossible. Now, they're both able to work together for the betterment of the user member. So let me talk a little bit more about the W2 network and really why we expanded. As we saw, there was a huge need for more therapists. And so we looked at creating a W2, meaning full-time therapy network within Talkspace. Now, we've also kept our 1099 contractual folks. Many of them work for us and we have great outcomes. But that ability to have full-time therapists in all 50 states and working with them to make sure that there's availability. These W2s, a number of them are also licensed in multiple states, allowing us to handle any kind of flow in one region versus another, versus one state over another, so that we're able to serve as many people and get ahead of the need as much as we can. They're licensed and they're in state. And what we do is we credential them using NCQA standards that all payers and insurance companies use. So we really make sure that they fall into the credentials needed to be licensed and delivering care in each state. And with that, again, just reminding folks that diversity has been top of mind, both with this W2 expansion and with psychiatry. And in fact, in psychiatry, almost 60% of our psychiatric prescribers identify as non-Caucasian. So we're really proud of that build and what we've done. Next slide. So now onto the exciting part. And Laura, can't wait to hear from you and also, maybe ask a couple of questions. So I'd like to introduce Laura DeCook, Wellbeing Specialist from Expedia. Laura, the floor is yours.
Thank you so much, Pablo. It's so exciting to hear all of the new exciting things that are coming out of Talkspace. So I'm here to tell you a little bit about what Expedia Group has been doing around the mental health space since early 2019, so pre-pandemic. So for those of you who don't know about Expedia Group, we are a company that powers travel for everyone, everywhere through our global platform. We are driven by the core belief that travel is a force for good. And we have a lot of products from Expedia.com to Hotwire to Travelocity to Orbitz. So yes, so please check out Expedia Group for your travel adventures. So at Expedia Group, we don't shy away from openly speaking about well-being and mental health. And we have a pretty robust mental health program at the company. We actually now have 145, last I checked, mental health first aid responders, which we call mental health ambassadors. They're certified and trained in mental health first aid. And I actually became an instructor myself during the pandemic. So we also have an amazing wellness reimbursement that's not listed here, but this was new during the pandemic. Because we're a travel company, we always gave people travel benefits, but we combined it with wellness benefits this year, so people could use their allotted amount to spend on a mental health first aid course, or maybe downloading the Calm app, or anything well-being related. We also launched a brand new well-being site last year with focuses on emotional, physical, financial, social well-being, along with a separate section for people leaders. So that was really exciting. So managers could learn how to best support their teams, mentally and emotionally, which is super important during the pandemic. We also launched 2 new flashier sites for our EAPs, because as many of us know in this space, EAP utilization can be quite low. So we now have 2 new EAP sites. It's easier to figure out, how to get support through EAP. And lastly, we host many events with many mental health speakers at the company. A lot of our events are related to certain mental health awareness days, such as World Mental Health Day or Suicide Awareness Day. So last year it was quite exciting. We had a really diverse group of speakers from all around the world speaking about the stigma of talking about mental health in Asia. We had Dr. Joy Bradford, who runs Therapy for Black Girls. So it was really exciting. Everything was done online and was really accessible to our global employees. We're actually located in 55 different countries, and we have close to 23,000 employees. So now that everything is virtual, it's just been really great to be accessible to all. So next slide, and I'd love to talk to you about Talkspace and our partnership. So as I mentioned before, so our EAP utilization was extremely low. And even though we offer therapists and counselors and life coaches through EAP, we weren't getting the numbers we wanted to see. And we knew people needed mental health support. So with everyone going remote during the pandemic around the world, we needed to make therapy more accessible to folks. And, as many of you know, the pandemic affected the travel industry incredibly. We're just rebounding right now, but our need to accommodate this diverse and global workforce led to our partnership with Talkspace. So we were amazed. We partnered with Talkspace starting in January of this year. We had 1,000 people sign up our first month. 65% were brand new to therapy, had never spoken to a therapist before. And 90% were actually immediately connected to a provider through Talkspace. So, the top issues employees were feeling during the pandemic: anxiety, depression, so many things that we could all relate to during this, this time in our lives. So, employees were telling us that they absolutely loved having this 24/7 access to therapy through Talkspace. They were able to do everything online, like leave text or audio messages for their therapists. And I actually just want to end before we go into questions, an amazing quote that someone said to us. I think it was from our India office after we launched Talkspace. They said, "Thank you to Expedia Group for breaking the stigma of self-care and personal therapy, that we don't have to internalize the weight of our personal world, and that we have resources to support us." So I'll bring it back to Pablo, just a little bit about what Expedia Group has been doing in our partnership with you.
No, Laura, that's so exciting to hear. And I think, what I'm excited to hear about was both what you spoke on the first slide, and really looking here again at what you continue to do. And I'd love to hear a little bit more about what it meant for Talkspace and Expedia to be able to answer the need in India,
Yeah.
and how that was handled, and your
Yes.
thoughts on that.
Yeah, thanks for bringing that up. So, as we all know, the COVID crisis is just still raging in India. We're getting back to normal here, but in India, they're still suffering greatly. So we reached out to Talkspace about 2 weeks ago, actually, and said, can we have more slots for our India team? The time zone's basically the opposite of the US. So, I believe like 8 a.m. in the Bay Area where I live is 8:30 p.m. in Delhi. So the India employees were only seeing therapy slots available at 2 a.m., 3 a.m. And obviously nobody wants to, talk to someone in the middle of the night. So Talkspace was amazing, immediately offered us more sessions to address this dire need in India. And we were able to connect our Indian employees. We have a pretty big office out there. We were able to connect them immediately with more time slots for therapists, more time zones, so time zone friendly appointments. So that was really exciting.
Oh, that's great, Laura, and great to be able to work with you to really answer that need and such a crisis still in India. And what it leads me to ask is, as you talk about the ways in which you've tried to make things more available, and you are doing that, and revamping things, and just getting things out in front of people and servicing populations in need. Please sum up to me, what is the approach, the belief to mental health at Expedia?
Yeah, if you had asked me this 2 years ago, I would have given you a completely different answer.
Mm,
And I always say, I don't like saying this, but I feel like it really took a global pandemic for all companies to start truly paying attention to the importance of mental health support. We had, we knew we wanted to work with Talkspace pre-pandemic, but after the pandemic, I'm finding that so many people are during, we're still dealing with it, but I find that people are so much more open about speaking about mental health. The stigmatization of talking about your mental health, I've seen it completely change at this company. I see people we use Slack communities for conversation. We started an Expedia group well-being Slack channel. We have the ability inclusion movement board. I think we have, like close to 1,000 members, about 1,500 members on the well-being board, where people will openly discuss their mental health journeys. And through some of these events that we've had lately, we've had employees talking about how they, about their mental health journeys, and we've had leaders talking about it too. I think I've seen every leader, including our CEO, speak about mental health during the last year. So, we couldn't be more excited to have Talkspace, where we found that so many folks, especially our engineering community, they were more reluctant to speak to a therapist face to face on a regular basis. So having the ability to have it, through chat or audio or video has been a lifesaver for so many people. And I have received so much amazing feedback about having therapy, in the palm of your hand, through your phone, through Talkspace. So, I just, it's amazing to see how the landscape has changed and how the stigmatization has gone away. And, maybe it took a global pandemic, but, it at least, people are talking about it now.
yeah, no. And I think you mentioned, Laura, I'm so glad you highlighted one, the leadership and what the leadership did in the face of this and supported all of you in the work you're trying to do, right?
Yeah.
And we see how impactful that can be to really making sure that they just have the different access points. So,
Exactly.
whether it's messaging, text messaging therapy, or it's a live video session, people had an option, and to remove the barriers. And was the Talkspace name helpful? Because we're known for trying to really go after stigma and remove it as a barrier. Because that's been helpful for the employees.
Oh, it's
it
been
like,
so
well.
helpful.
Yeah.
And people knew of Talkspace through the ad campaign through the US. People, so it's really exciting because we actually are offering Talkspace globally to, our 55 countries. So that was pretty groundbreaking. But in the US, it was quite exciting for people to be connected to Talkspace because they had seen the commercials with Michael Phelps and Demi Lovato, and they already thought it was going to be like something cool to try. So,
Mhm.
I think for, our workforce being in the, the majority of our workforce being in the, early 20s to maybe mid 40s, I think that was really exciting to have partnership with a really well-known and reputable company like Talkspace.
And likewise, what you've done. So that's really, it really takes us as a team
Yeah,
to take that stigma on and increase
it
that
does.
access. And
It does.
so, great stuff. Well, Laura, thank you so much.
It's my pleasure.
Yeah, yeah, yeah. It's been great to hear what's going on at Expedia. And Laura, one other question that comes to mind as we're finishing up, and we've talked about your journey, the journey at Expedia, and the growth, from national to international and services. For those HR folks, for those company folks out there really trying to understand what's the first step, right? They really hadn't been able to, and they're now still collecting information and just trying to look through everything and understand, how do I get support like Talkspace, or
Yeah.
how do I support my employees and their families more around mental health?
Yeah, yeah. I mean, even though so many companies have, taken a more of a, or have made well-being and mental health support more of a priority during this pandemic, it is not too late to start. Even though, I mean, this pandemic is still going on in so many places around the world. We're not done here in the US. Yes, things are looking a lot better, but people are still really suffering emotionally and mentally, and even the post-traumatic stress that occurred because of the pandemic. They said, I remember hearing that they said mental health issues were going to be the next pandemic.
Mhm.
And I think it is not too late to start. I think look into what Talkspace can offer you and your companies. I think see what your tell people what your EAPs offer. I know in the beginning when I asked at a town hall meeting what the company was doing to support folks in their mental well-being, and this was pre-pandemic, the first thing the head of communication said was EAP. And people didn't know what EAP even was or what EAP even offered. So I think just making that accessible, easy to understand for your companies, just knowing that the mental health first aid program is amazing. It's, the company can help fund it, the employees can fund it themselves. Getting trained to recognize signs in, yourself and others who may be suffering, I think is super important. Just, all companies, no matter how big or small, need to be prioritizing well-being from here on out. If you weren't before, you need to start, because we've noticed that attrition rates, with having these well-being resources, people don't want to leave the company. They said, one person said they had never been at a company that offered so many well-being resources. And we went from having EAP to now this amazing partnership with you at Talkspace, and to have, therapy 24/7. I mean, it's pretty groundbreaking to have gone from nothing to 24/7 therapy. So, just start somewhere.
Great advice. Thanks so much, Laura.
Thank you.
And why don't we just, as we near our end, next slide, and we'll get everybody going. So really, just to review, I think what's great is that Talkspace is able to show data and numbers, and that is so important in understanding the efficacy of what we do, as well as looking at how we can improve or what we don't change, what works well. And so really important to do all of that. So we want to look at kind of growth, adaptation, and the path toward future expansion. And looking at really high scores for psychiatry services, which is so important. Again, so hard for people to get connected and to get connected to an available psychiatrist, and one that they're satisfied with. So that's really important right there. At 78%, that's pretty big. In my past years and lives, I had to deal with many people frustrated with a psychiatrist they finally got to meet that they didn't connect with. And so, through Talkspace and our algorithm, we're really able to get people connected quickly and to somebody they'll get along with. And then, going back to the couples piece, and Laura, like you were saying too, there's never been a time probably that family and couples have felt such a pressure to both work and take care of the kids or the dogs, and to be basically, for so many people, on top of each other, when we had all those natural breaks and boundaries that existed before the pandemic. And so here we have Lasting, this couple service, and that 94% of Lasting's users report stronger relationships. And I mean, if that's something you can do to help people improve their relationships, because in the end, it really is about someone's sense of home and family and feeling safe and secure. And then there's really our strong number here, and this is something we're really proud of, Laura, both with you at Expedia as well as just in general, is the 95% of users that are matched get matched in under 24 hours. And that's huge. I don't know if you remember, Laura, if you ever had a friend, or I might have had a friend or family member looking for a therapist, and they'd ask me for a referral.
Right.
And I don't know about you, but I'd go like, oh my gosh, like, what am I, I'm, inside, I wouldn't say that outside, inside, okay, so got to find somebody with the right insurance, who's available,
Yep.
who's physically close.
Exactly. I actually did it this morning.
Oh yeah, it's a crazy process, right?
It is.
It really is. And I've had friends ask me about Talkspace, and I've been able to say, well, actually, you go through an algorithm, it only takes a couple of minutes to fill out, and you get connected with somebody, and most likely you'll stay, you'll also stay with that person. And so we see really high satisfaction scores with their therapists, and that's the important thing there. And then why are we here in the end, right? To reduce stigma, but also to get people better. And how do we do that? But what we've seen is 70% of users see clinically significant improvement within 3 months of use. And that's huge. Again, we're able to measure it, let alone see such an increase. So again, helpful, and also frankly, transparent. It's really not just a transactional relationship where somebody went through your directory of benefit and found a therapist, and you never knew what's happening to your workforce or their family, right? And here we can give that information. So to finish it off, Laura, and just the folks in the crowd, it's really, we're excited because we have the Talkspace IPO and next. And I think what's so important, what we've seen is a dramatic rise in drinking and other use of other substances, both legal and illegal. And so alarming rates of that. And so we're looking to expand our coverage and really kind of say a dual approach of mental health and substance abuse work. And then also look at chronic condition management, because, some folks out there might have something physical, medical, but it has an impact on their mental health. And we have to look at how to support those people, and how to support those people who might be working at your company today, Laura, that are also, challenged and might have some shame on what's happened physically, or just frustration or fatigue from it. So how do we cover those people and support them? And then, of course, in the end, I don't think anybody envisions being in therapy for life, right? And that most people want to come, figure out the tools, and then move on. And what we're really trying to do is expand our self-help toolkit. We've already got some great exercises to help people, kind of mind, body, spirit approach. But how can we enlarge this? How can we give people the tools that, for instance, like Laura, you were saying, how can we give that engineer who's maybe doing some messaging therapy some tools where they may not need to come back, or they may only need to come back for a checkup, or it might be a different issue, but we give them the tools to handle why they came to us today. So that's really important. And then last but not least, as Laura, you and I were talking about, in India and just the rest of the world, I mean, right outside these our own borders, is really a need internationally, and how do we support? So deepening that international content and services, and how we do it and how we reach. So we'll be glad to go row with you and your population, Laura, as well as our other clients, and see how we can serve those members and destigmatize and increase access. So with that, I'll take the next slide. And so in the end, what we do is we provide therapy when people need it, as well as psychiatry, whether someone's coming looking for a psychiatrist or the therapist recommends a psychiatrist. and that therapists and psychiatrists can work together. And then obviously to help build tools in those person's toolbox. So when they go on in life, they can still also come back and access their account and do self-guided exercises. And then when you're talking about self-guided exercises, how do we strengthen the impact of this pandemic, as well as technology, stressed work environments, and really help couples with relationship tools? So with that, thank you so much and have a good rest of your day.